proudly covering all of northeastern and central Pennsylvania. This is Eyewitness News at 11.
Good evening. Glad you could join us on this Thursday. I'm Nick Toma. Fighting the COVID-19 pandemic is a team effort shared by everyone across the globe, the nation, and the Commonwealth. Eyewitness News reporter Kevin Hayes found a former Dunmore Buck who's now on the front lines in the Lone Star State. He joins us live in Dunmore with his story. Kevin?
Well, Nick, down in Texas, they're expecting a surge of COVID-19 cases in the upcoming weeks. Dr. Ralph Riviello graduated from Dunmore High in 1986 and has had a wild ride since then, one that has almost certainly prepared him for the task that he has uptaken today. From humble beginnings in northeast Pennsylvania to heavily hit Allegheny County and Philadelphia, Dr. Riviello has been building a resume and connections almost tailor-made to combat the coronavirus pandemic.
So I've been in contact with some friends and colleagues that are still in Philadelphia, getting some updates, getting some information. We're reaching out to colleagues all over the country.
Riviello says there's more preparation down south with fewer cases. He says all due to early stay-at-home and shutdown orders in the San Antonio area.
We predict our surge will probably happen in the next few weeks because we were able to flatten that curve, and we don't think it's going to be as even high as initially predicted, but those are only based on the predictive models.
On his journey to Texas, Riviello has seen the front lines of infectious disease scares in Philadelphia with the Ebola virus. Now, his department in San Antonio is preparing for the fight of their lives.
So there was a lot of planning, coordination, drilling of scenarios.
Drawing on his experiences from the cities of steel and brotherly love may make the difference.
And there is a ton of information exchanged by physicians around, what they're experiencing, what worked, what didn't work, how they're handling PPE, how they're handling certain procedures.
As well as focusing on the silver lining.
We're not focusing on the death, but we're focusing on the recovery and what we could do based on those people who recover to help those who are currently sick and fighting it.
Now, Riviello tells me that his staff and their higher-ups and the entire network across the country, the information has been flowing in, and it's been an invaluable tool in fighting this pandemic. His team regularly conducting drills for preparedness down in San Antonio, and he's trying to make sure that everyone back up here in his old hometown is proud of the work that he's doing down in the Lone Star State. In Dunmore, Kevin Hayes, Eyewitness News.
Kevin, thanks. And Bexar County, where Dr. Riviello is on the front lines, accounts for 890 of all the cases total in Texas. Lackawanna County.
Our biggest challenge currently is fear of the unknown.
Dr. Ralph Riviello is in charge of emergency medicine at University Health System.
We don't like to panic, but we want to expect and prepare for the worst.
Preparing for scenes like this outside of hospitals in major cities like in New York. Hospital staff there overwhelmed with the surge in coronavirus patients.
But if you follow, the numbers and the patterns from the other cities, we are probably very early in our COVID exposure, and we do have the potential to mirror any other major city, but I think we got ahead of it pretty early, much earlier than some of the other cities.
Not knowing what's to come is daunting. But Dr. Riviello says staff at University Hospital are ready.
Making sure we have the resources, the physicians, the nurses, the staff, the equipment to take care of patients.
During this coronavirus fight, Dr. Riviello and other physicians nationwide are coming across new symptoms.
We're also hearing of cases where patients are reporting loss of taste, loss of smell, and are coming up COVID positive.
As they care for patients who fear they have the virus, University Hospital is hoping to avoid a large spike in cases all at once.
I think we're as prepared as we can be, and we're just going to have to wait and see what happens.